Hi, so I'm Louise and I'm from Carers Trust. I'm the Dementia and Older People's Policy and Development Officer. So it's my job to raise the profile of people who are caring for somebody with dementia and all of older carers, regardless of who they're caring with. And that's around government policy, NHS legislation, NHS policy, and also public health and that sort of thing. So if you've got anything that during the day that you want me to feed back to the powers that be, as we like to call them, then let me know and I'll make sure your voice is heard through mine when I go to these places to speak or to network and such like. So, as Howard said, the Road Less Rocky is a project that was commissioned, well, it was research that was commissioned by Carers Trust to look into the experience of carers who are caring for somebody with dementia. Carers Trust is a national organisation, as I said, that does lots of work around policy, research, and we develop materials to be used locally. So within Carers Trust, there's then a network of carers services that are all around the country, and Suffolk Family Carers is a network partner of Carers Trust. So it's a bit like a federal organisation is the best way to think about it. And there are carer services throughout the UK. And they include carer centres, like Suffolk Family Carers, and crossroads services. Okay, we also have a young carers team as well, and a young adults carers team. So we just put a few stats up about carers of people with dementia. And I was hoping to read it off my thing, but I can't because it's too small. So, as you can see, 670,000 primary carers of people with dementia. And those are the ones probably that came through that are registered. So I think you can probably at least double that figure, because the first problem is getting people to recognise themselves as a carer. So there'll be many, many people out there who have a caring role that don't even see themselves as a carer. They'll see themselves as the husband, a wife, a parent, a daughter, a son, a neighbour, and not recognise the impact that it's having upon their life. So, many people who are caring for someone with dementia are also working. So people like to think about my age, who are supporting elderly parents or supporting one parent to care for another parent. So that in some cases they're trying to run two homes, go to work, bring up children. So that has issues of its own. And then of course many people caring for someone with dementia will be elderly themselves. And as we get older, we get tireder and we start to have what we call old age complaints. So things like arthritis and mobility problems. And all of these will impact on the person who's caring for somebody with dementia. Quite often within older couples, you'll get two people who, what I like to say, are less bobbling along together. So they're supporting one another and managing. But if one of those goes down, then the situation it becomes very, very difficult. Okay. So, statistics about older carers are also very interesting, because the older the carer is, the more hours they report they're caring. So at a time in your life when things are getting more difficult and you're getting more tired, if you're a carer, you tend to be doing more hours of care in that week. And research also shows that people who care for somebody with dementia, well, all carers, but particularly those who care for somebody with dementia, have poor health outcomes themselves. Very good at neglecting their own needs. On to the Road Less Rocky. As I said, it was research that was commissioned by Carers Trust and carried out by the University of York. And what we wanted to do was ask these three questions to carers. So, what are the key stress points in the caring journey when support and advice is needed? What are the key types of advice and support needed at what times in relation to the carer's life and well-being? And the same question again, but in relation to the person that they're caring for. So in this case, the person with dementia. Okay. What came out of the research? Research was done with focus groups of carers groups around the country, some online questionnaires, and some one-to-one interviews. So various types of interaction there. And, as I said, it came out with the 10 critical points, which is what Howard has picked up for the forums, to look at the 10 points that carers said were critical along their journey of caring for someone with dementia, and try to address those at the carers forums. Okay, so the 3 points that almost all carers said that they came across and were an issue for them. Well, when the person is diagnosed with dementia. When the carer takes on an active caring role, so it's a bit like I was saying before, when your caring role starts to impede on your own life a little bit, so you're stopping doing the things that you used to do so readily because you're caring for somebody else. Maybe you cut your hours of work, that sort of thing. And when the capacity of the person with dementia starts to decline. So all of those issues were massive for carers of people with dementia. And then, from the research, came out two really pivotal points along the experience of caring for someone with dementia. The first one is about behaviour. When changes in behaviour happened, carers didn't feel they had the right advice, information, training to be able to manage the difficult changes that were happening to the person that they care for. And the next really critical point was when the person with dementia becomes incontinent. Not everybody will, of course, but when people do, it is a massive issue for carers. And those two put together, the difficulties in behaviour and incontinence, and getting people to understand how to use continence aids and to try and get people to understand where the bathroom is now and such things, were just quite often the point where carers started to look at residential care. So I think it's just really important that people get advice early on about these two major issues so that maybe people can manage to care at home for longer. So these are some other issues that came out through the research, and one is when the carer has to cope changes. Oh, sorry, that's clicked on. When the carer needs emotional support and/or a break from caring, and that's for themselves. And there's a little quote up there from the carer. I really need to be able to talk at length to someone about the problems I face. I feel isolated and so very tired. And I think we hear that a lot from carers, all carers, but particularly those with dementia. Sometimes, I think it is changing, but the stigma that sometimes is perceived around dementia makes people even more isolated, so they don't talk about it so readily as they would if someone had had a stroke or they had a heart attack or something. And so hopefully that is changing a little bit. And please, if you do feel like that, there are wonderful people at Suffolk Family Carers who can talk to you. There are peer groups around the place, and there are also national online forums for those that are busy with their old IT. So another point was when the person with dementia loses mobility. And of course, as the majority of people who develop dementia are older already, they may well already have difficulties with their mobility. But it was just an added complication to the carer, having to move somebody, position them, hurting themselves doing this was a huge problem. And again, not having the right training and information about keeping themselves safe when they're having to help somebody else whose mobility is declining. If you think about when a paid care worker comes into your home, the health and safety is just immense, isn't it? They won't leave people on their own, they have this and they have that, they have proper training. Yet quite often carers are sent home from hospital with the person they care for without any of that. So, some other points that came out in the research. So, when the person with dementia has other health problems, and in the trade it's called comorbidities, new word I learned this year. So when somebody with dementia also has, say, diabetes or heart failure or arthritis or any of these conditions that need day-to-day management, it can be really difficult because as the dementia progresses, it will be the carer that is maintaining the health of the person they look after. So making sure that they have their medication, making sure that they stick to the right diet. And when someone has memory problems and some confusion, of course this is much, much harder to speak to somebody about their own health and convince them that they need to go for a walk and they need to stop having sugar and such like. So that's a huge issue for carers. And the next one is when the carer's own circumstances change. So dementia is a very long-term condition for most people, and carers may find themselves caring for somebody for over 12 years, which is a huge amount of time. And during that time, it would be unusual if their own life didn't change. So at some point, their own circumstances may change. For example, their own health might deteriorate. They may become long and have to go into hospital for an operation themselves. They may have had to give up work, so their financial situation has changed. Or, quite a big one, sometimes they have support from family who are living at home that then move on and away, so they lose that family support that they once had. So it's always good to just recheck if you're working with carers, or if you're a carer yourself, to remember to recheck yourself and whether people are okay or they need some more support as they go through that experience of caring. So the next and the last other issue of the 10 critical issues that were raised was when decisions are made about residential care and end-of-life care. And carers felt that quite often they weren't informed about what's available in residential care or what to prepare for or to plan for later in life. And we'll talk a little bit more about that when I do the session on when somebody becomes an active carer. But it's really important to have conversations about this early on, because carers were saying that quite often in a crisis they were asked to find a care home. So somebody was in hospital and they were well enough to come out of hospital, and they were being pressured by the hospital, as we all know, to move out of general hospital and into either residential care or back home. And so carers often found themselves trying to find somewhere on the hoof very, very quickly in a crisis. But much better if carers were given that information early on. It may be that somebody never goes into residential care, but at least if you have that information to hand, it's less of a concern when it happens. And also about understanding the different types of residential care, because I've known carers to spend a week searching and searching for a care home, and they find one and it doesn't offer the support that's needed because somebody hasn't told them what sort of care the person that needs it needs within that part of their environment. So that was huge as well. And then carers sometimes felt that they weren't involved enough with end-of-life care, even when there was or wasn't a lasting power of attorney, that they should be much, much more involved and part of the consultation. Okay, so in conclusion, my conclusion is really for professionals, because I quickly followed this PowerPoint from them, but really, throughout this journey, you as carers or you as professionals will encounter carers, and it's really important that you identify yourself as a carer if you are a carer, or help friends and family to do that, and if you're a professional, to just be mindful all the time and have in the back of your head, is this person a carer? You know, they've come along to the appointment today to have this guy's feet done. Are they caring for him? And to get them to identify themselves and to give them a little bit of advice and support, and make sure that they contact one of the local carers or dementia services. So, as we say, if it's really important, what the research showed was if the right information, advice and training had been given to carers at the right time throughout their caring journey, that their experience would have been a little easier, but also they may well have been able to keep caring at home for longer, which is a real pivotal issue, I think. So, from this, I recently made a toolkit. I was asked by my new boss, can you make a toolkit to go with the roadless Rocky? And I've never made a toolkit, I didn't really know what a toolkit was. So I googled toolkit, and B&Q came up, so I thought, I don't really think that's what they want. So anyway, I looked at some that were online, and obviously it's a resource. So from the roadless Rocky, I've made a resource which is on the Carers Trust Professionals website, and it's a guide to professionals, talking them all through the different stages that we've just spoke about, those 10 points, and telling them how they may be able to support carers and how it feels for a carer at that time. So all the information was taken from the research. This week we also launched a carers roadmap, which I also wrote, on the carers.org website. So, but I'll be here, and if anybody wants the web pages, I can give them to you. And on there, it's designed for carers themselves. So it goes through the 10 stages. Well, I've broken them down a bit more, so there's now 13. The carer said that maybe they needed to be broken down into smaller sections. And it really takes somebody through all of those points in the journey. And they're both web-based at the moment. So what they do is they link people into more information where they can get more help, and into fact sheets. So for example, where it's on the first section, where it says what is, when somebody is diagnosed with dementia, then it passports people through to the Alzheimer's Society, where they've got some wonderful information about different types of dementia. It would be silly for me to rewrite all that when they do it so well themselves. So that's how it works. But what I'm doing as well is I can set it up at lunchtime so people can come and have a little look on the internet and have a play about.